Hello, and welcome to Virginia Medicaid Waivers, a presentation by the ARC of Virginia. This is especially for individuals with developmental disabilities, family members, educators, and disability service providers who want to learn about the basics of Medicaid waivers for people with or at risk of developmental disabilities. The ARC of Virginia is a state chapter of the ARC of the United States, which is the nation's oldest and largest organization of and for people with intellectual and developmental disabilities and their families. The ARC's mission is to promote and protect the human rights of people with or at risk of developmental disabilities and actively support their full inclusion and participation in the community throughout their lifetime. In this presentation, we are going to cover Medicaid health insurance, Medicaid waivers, waiver services, eligibility criteria, the application process, and tell you how you can get help and more information. Let's look at the terms Medicaid and waiver separately to understand what they mean. Medicaid is the insurance that pays for waiver services. Waiver means that the requirement that Medicaid services be provided to all in the state is waived or not required. Instead, the services in the waiver are only for select populations. Put together, a Medicaid waiver provides the insurance that pays for the services that are only available to a select defined population. When a person has a Medicaid waiver, they have Medicaid health insurance and they have access to the additional waiver services that only people with Medicaid waivers may use. Medicaid waivers, also known as home and community-based care waivers, were created so that states could provide alternatives to having to live in an institution such as a nursing facility or hospital-like setting to get needed services. Let's look at the what and the why of Medicaid waivers. Medicaid waivers are a long-term support system for people of any age with long-term care needs. Many people with developmental disabilities have long-term care needs. A waiver offers a menu of supports and services for people to live in the community versus in a nursing home or hospital-like environment. There are numerous waiver services in areas including personal care, respite, employment and day services, residential and skill building services, nursing, environmental modifications, and much more, depending on the type of waiver. Waivers are the only public funding source for long-term developmental supports. There are critical points in life when we are impacted by events that change what we need to be healthy and live safely. When a young child has significant medical or behavioral needs that require 24-hour care, when a young adult is finishing their public schooling, when someone can no longer receive care from your parents, these are just a few examples, then the supports available through the Medicaid waiver are the only available public funding source. Medicaid is overseen by the state and federal government. Virginia's state Medicaid agency is the Department of Medical Assistance Services, or DMAS. The federal agency is the Centers for Medicare and Medicaid Services, or CMS. Both of these agencies have financial and regulatory roles. Who pays for Medicaid, including Medicaid waivers? State and federal tax dollars pay for waivers. The federal government mandates that states with Medicaid, and all states do have Medicaid programs, provide certain services that you see listed on the slide, including EPSDT, family planning, health clinics, home health, hospital, lab and x-ray services, Medicare premiums, nurse midwife, nurse practitioner, nursing facilities, physician services, and transportation. States may choose to provide optional services. Virginia has chosen to provide these optional services: case management, home and community-based waivers, hospice, intermediate care facilities, mental health, psychology, optometry, physical, occupational, and speech therapies, podiatry, prescribed drugs, prosthetics, and home health. The Medicaid waivers that we are going to learn about are called broadly home and community-based care waivers. What is noteworthy is that waivers are optional. States do not have to provide Medicaid waivers. Some people may have to pay for some DD or CCC plus Medicaid waiver services if they have income over $1,292 a month. Patient pay is paid each month. There are some exceptions for people who are working. Once a person has a waiver, then they must apply for Medicaid if they don't already have it. They will have a Medicaid card. They will have Medicaid health insurance. They are eligible for all the services in the waiver. Most people will be enrolled into a Medicaid managed care program. Virginia's Medicaid managed care program is called CCC Plus, or Commonwealth Coordinated Care Plus. So that means in Virginia, we have two separate things that share the same name, CCC Plus. The two separate things with the same name are the CCC Plus Managed Health Care and the CCC Plus Waiver Services. HIP, or the Health Insurance Premium Program, is a Medicaid program. It is for Medicaid members who also have employer-based health insurance. The employee may be eligible for the Health Insurance Premium Program. HIP may pay a portion or the total insurance premium for qualifying plans by reimbursing the employee. An application separate from the Medicaid application is submitted to the Department of Medical Assistance Services. For more information, go to the link provided or call the 800 number 432-5924. A child with a waiver may have private health insurance, which is primary, and then their Medicaid health insurance is secondary. The Developmental Disability, or DD Medicaid Waiver, and the Commonwealth Coordinated Care Plus waiver programs are the waivers that are most frequently used by people with disabilities. The Dd Waiver has three types of waivers. They are the Community Living, Family and Individual Supports, and the Building Independence Waiver. The other waiver program is this Commonwealth Coordinated Care Plus waiver program. It does not have subtypes of waivers like the Dd Waiver. The CCC Plus waiver was created in 2017 when the old ED, CD, and Tech waivers were combined into the new CCC Plus waiver. Let's compare these two waiver programs. For the Dd Waiver, a person must have a developmental disability diagnosis, or if they are a very young child, if they have conditions that put them at risk for a developmental disability, they may be eligible. The Dd Waiver is a comprehensive waiver with 30-some services that include the widest range of services and supports for home, community, medical, work, skill building services, and much more. It can provide up to 24/7 supports if needed. The Dd Waiver has a large but needs-based waiting list. It is operated by the local Community Services Board. For the CCC Plus waiver, a person must have a disability diagnosis. It does not have to be a developmental diagnosis, and they must have a medical need. The CCC Plus waiver has fewer services. It has 9 services that are more limited to supports in the home, nursing, self-care, some community support, and more, but no work or residential or skill building services. It does not provide 24/7 supports. The CCC Plus waiver does not have a waiting list. It is operated by the local health and social services departments. To be eligible for either waiver, there are 3 criteria that a person must meet to be eligible. They are diagnostic, functional, and financial criteria. The financial criteria are the same for both waiver programs. Many people think that for Medicaid waivers, parent or family income is considered. That is not true. Parent family income never counts. There's no resource limit for children. However, for adults 18 years plus, there's a monthly income limit of $2,382 per month, and there's a resource limit of $2,000 per month. Now we're going to focus only on the CCC Plus waiver program, the services it provides, and the application process. The CCC Plus waiver is based on the need of the individual. A person may use one or more CCC Plus waiver services, and their services may change as their needs change. The CCC Plus waiver services are adult day health care, personal assistance, private duty nursing, respite care services, facilitation, assistive technology, environmental modifications, the personal emergency response system, and transition services. For personal and attendant care, a child or adult receives assistance from an attendant to help with everyday activities such as dressing, bathing, eating, mobility, toileting, and supervision. The care may take place in any environment. Some waiver services may be delivered through the consumer-directed model. In the consumer-directed model, the person with the waiver or a parent or family member recruits, hires, trains, and supervises and fires the attendants. In the agency model, attendants are provided by an agency who handles all of those functions. Personal care is also a service in the Dd Waiver. Assistive Technology pays for technology that assists the child or adult to be more independent in activities of daily living, such as bathing, eating, and communication. Devices are usually portable and may include specialized medical equipment, communication devices, or controls. To use this service, the process is that there is a prescription for the AT evaluation. The evaluation is by a qualified Medicaid professional. There's a quote by the Medicaid Assistive Technology provider. There's delivery after authorization. This is limited to $5,000 per calendar year. This is also available in the Dd Waiver. Environmental modifications are physical adaptations to the home, vehicle, or work site that enable the person to function with greater independence, ensure safety and welfare of the individual. Modifications to a primary home might be things like ramps, accessible rooms, security features. Modifications to a primary vehicle, some examples might be lifts, ramps, or hand controls. This is limited to $5,000 per calendar year, also available in the Dd Waiver. Private duty nursing is continuous care up to 16 hours a day. It's only available if not covered by a person's private health insurance. You have to meet very specific medical criteria for people who, for example, might be on a ventilator or need highly specialized medical technological support. This is also available in the Dd Waiver. Respite gives the parent or primary caregiver a break from providing care. It can be provided in any environment. 480 hours is the amount of respite care available a year. It's a consumer-directed and agency-directed service. It's also available in the Dd Waiver. Adult day health care. Adults usually go to a center for social and recreational activities. This is typically used by people who are elderly who cannot be left alone. Transitional services are for people transitioning from a nursing facility to a community home. Up to $5,000 for expenses is available. Personal Emergency Response System, or PERS. Think of Life Alert or Medicaid medication management system. For this, the individual must not be able to use a phone in an emergency, must be 14 years or older, left alone for a portion of the day, and has the cognitive ability to use the device. This is also available in the Dd Waiver. Now we're going to look at the eligibility requirements for the CCC Plus waiver. Who is eligible for the CCC Plus waiver? People with a disability of any age or people who are 65 years or older. Mental illness does not qualify as a diagnosis. A person may have mental illness, but they must have some other disability if they're under the age of 65. The person must have a medical nursing need and must meet the nursing facility criteria. That means a person must be at risk of nursing facility placement, at risk of nursing facility placement within 30 days. The assessment tool used to determine if a person meets the 3 criteria is the Uniform Assessment Instrument, or UAI. The UAI assesses a person's social, physical, and functional abilities. The screening is completed by a nurse from the health department, or it may be done if the person is in the hospital. To apply for the CCC Plus waiver, you contact your local Department of Social Services or your local health department. Different localities have different starting points to get a screening. When you call to request the screening, be prepared to answer a few questions. Be able to identify you or your child's disabilities, you or your child's physical health diagnoses, the CCC Plus waiver services that are needed. And do not say that you want to be screened for this waiver because you just want to have Medicaid health insurance to pay for therapies. It must be that you need some of the CCC Plus services, and you do not have to have Medicaid at the time of the screening. Now we're going to look at the Dd Waiver Program and the services it provides, eligibility criteria, and application process. Services are based on the need of the individual. A person may use one or more of the Dd Waiver services, and services may change as the person's needs change. The 30+ Dd Waiver services fall into some broad categories such as employment and day options, consumer or self-directed options, residential services, behavioral crisis, medical, and a pretty long list of others that are additional options. You may remember earlier, we said that the Dd Waiver has 3 types of waivers. They are the Community Living Waiver, Family and Individual Supports, and the Building Independence Waivers. Different waivers have different services. When your needs change, you may request a different type of Dd Waiver. Let's look at the 3 types of waivers. The Building Independence Waiver is only for adults 18 or older. The person owns or leases their home or apartment, and it's for people with minimal support needs and fewer services. The Family and Individual Support Waivers for people of any age. The person lives with in their own home or apartment, or with friends or with family, and it may include extensive supports, including medical and behavioral, up to 24/7. The Community Living Waivers, also for people of any age. The person lives in their own home or apartment, or with friends or with family. It includes extensive supports, medical, behavioral, up to 24/7. It is the only waiver with the segregated group home and sponsored residential services. The main difference between the 3 types of waivers is residential services. In the chart, you see 6 residential services on the left-hand side. Independent living services is only for people who have the Building Independence Waiver and need fewer hours of training to live in their own place. It is not available in the Family and Individual or Community Living Waivers. Shared living is where a person lives with another person and receives some supports from the other person, and it is available in all 3 waivers. Let's jump down to sponsored residential, where up to 2 people with a Community Living Waiver live with a family in their home, which is licensed. The group home service is only available to people with a Community Living Waiver, like sponsored residential. In the Dd Waiver, there are a range of services for people to access related to employment and other times when someone is not in school or working. This includes support employment, workplace assistance, benefits planning, group day, community engagement, and community coaching. Some of the other Dd Waiver Services are companion, electronic, home-based services, community and employment transportation, community guide, peer mentor supports, skilled and private duty nursing, and behavioral support. Remember the services that are also available in the CCC Plus waiver that are also in the Dd waiver. That includes personal care, respite, personal emergency response system, assistive technology, and environmental modifications. Now we're going to look at the eligibility requirements for the Dd waiver. For the Dd waiver, a person of any age must have a chronic disability that occurred before the age of 22. A sole diagnosis of mental illness does not qualify. So just like in the CCC Plus waiver, a person may have a mental illness, but must have another disability. Some developmental disabilities include things like cerebral palsy, autism. We'll talk more about them later. The person needs or likely will need lifelong or extended plan services. They must have substantial limitations in 3 or more areas of life activities compared to another person of similar age without a disability. And not all people with a developmental disability will qualify for the Dd waiver. Here are some examples of conditions that may be a developmental disability: autism, brain injury, cerebral palsy, Down syndrome, intellectual disability, muscular dystrophy, epilepsy, and spina bifida. A person's functional needs are assessed by determining the level of help or assistance needed, whether it is from another person or from a mechanical or technology system, compared to a person without a disability of a similar age. In the Dd waiver, a person is assessed in 8 different areas, including health, personal care, motor skills, behavior, communication, learning skills, community living, and self-direction. A person must need help in several of these areas, but not all 8. And in the Dd waiver, they must also be at risk of placement in an intermediate care facility. The VISE is the assessment tool used to determine if the person meets the functional criteria for the Dd waiver. It assesses the person's functional dependencies in those 8 areas that were on the previous slide. A representative from the local community services board does the VISE assessment with the person who is seeking a waiver and any other person that the person wishes to have present to give information. For children, parents are always included, and for adults, often family members provide information also. The VISE is assessing the type of help the person needs and the frequency. It looks at whether the person needs help from another person or technology to do activities, and how often does this person need help. This is the time that you focus on a person's challenges. So for example, if a 12-year-old needs assistance getting dressed, do they need someone to tell them what to wear? Do they know to wear weather appropriate clothing? Does someone have to get the clothes out of the drawer, the closet? Does someone have to physically help put the clothes on, or just tell them what to do? Also want to mention that the person being assessed does not have to be present for the entire assessment. So the thing that's most important for people who are being assessed to realize, and for any family members who are helping with the assessment, is what is the individual's current functioning, presuming there is no help or helpers of any type available. So that means there's no parents, there's no family, no paid or unpaid service or technology is in place. So if we go back to getting dressed, how is the person able to get dressed and there's no one else around to help? The ARC of Virginia encourages individuals and families to learn more about the waiver services and screening processes before requesting a screening for the CCC Plus and or the Dd Waiver programs. So do you have a copy of the VIDES? Do you have a copy of the UAI? It's good to have that in advance to prepare. To request a Dd Waiver screening, you contact your local community services board. At that time, you want to be prepared to report what you or your child's disability or developmental delay is and why you want the screening. Again, this is not the time to say that you want Medicaid health insurance to pay for therapies. You do not have to have Medicaid at the time of screening. If you're found eligible for the Dd Waiver, then you will be placed on a waiting list. This waiting list is large, but waivers are awarded based on need. It's not a chronological wait list. If you are on the wait list, you may be able to apply for the Individual and Family Support Program funds or rental assistance for those who are adults. If you are totally new to the world of waivers, this information can be very overwhelming. However, do not despair. All of the information we've covered is on the ARC of Virginia's website and YouTube. If you need help getting started and want to learn more about the screening processes for the waiver, feel free to contact the ARC of Virginia for individual consultations to guide you through this process. You may also want to view our presentation on what to do while you wait to learn more about the waiver application process and what to expect. So please stay in touch with us. We are available at the ARC of Virginia at 804-649-8481, and you can dial extension 104. You can email us at info@thearcofvirginia.org. So you can also stay in touch with us on Twitter and Facebook. Thank you very much for joining this presentation. If you have questions, please be in touch. And we always appreciate any feedback of how we can make this presentation better for you. Thank you very much. Goodbye.